So we've come up to our choking victim, and in this case, it's choking Charlie, which is the mannequin designed specifically for the use of demonstrating and training for choking victims. And what's the first thing we're going to do? Call 911, correct? Or have somebody that's with you call 911. Then we proceed to do the back blows, 5 back blows. If that doesn't work, then what we do is the abdominal thrust 5 times. Okay, if that didn't work, we go back to the back blows. Then the abdominal thrust. You failed using back blows and abdominal thrusts. Let's use the Dechoker. Tilt the head back just a little bit, make sure the mouth is open. Insert the tongue depressor portion of the Dechoker over the tongue. Get a tight seal over both the nose and mouth. Tilt the chin up. Form a tight seal between your thumb and 2 fingers, and pull back on the Dechoker. So let's say we're in the field and you're thinking that the obstruction is too deep. This would be where you might want to choose the McGill forceps. If you really believe it's too deep, obviously that's not the device of choice. That's where we want you to use the Dechoker. It can generate the pressure and get those deep obstructions. Again, tilt the head back, make sure the mouth is open, go over the tongue, lift up on the chin, get a nice tight seal, pull back on the plunger. As you can see, this obstruction is relieved.
So if you come upon a patient who is down on the ground, unconscious, may not be breathing, may not have a heart rate, and you begin to do resuscitation, the first thing you do is open the airway and try to give a breath. The benefit of this is not only trying to get some air into the lungs, but also making sure the airway is open. If the airway is not open, and if you're not able to actually give any breaths into the lung, then you have an airway obstruction. The next thing you do is a finger sweep. And the reason you do a finger sweep is to hopefully remove any sort of obstructing object, which may be in the back of the mouth, things that you could reach with your finger. If there's nothing in there, then what you may consider doing is going to McGill forceps, if you have any of those available. Sometimes with the McGill forceps you can reach a little bit deeper back into the throat and remove an obstructing object. If you can, wonderful. If not, then you proceed with your resuscitation and you begin chest compressions. When doing this, you would give 30 chest compressions, and the normal CPR treatment is to give 30 chest compressions and then go to 2 breaths. However, if the airway is still obstructed and you really can't be giving 2 breaths anyway, at this point you might want to consider using a Dechoker. You have a small amount of time when you would have stopped your chest compressions and would be giving the 2 breaths. During this time, you could try using the Dechoker to try to open up the airway. With or without success, you then go back to the chest compressions. If you were successful with a Dechoker and were able to open the airway, then upon completion of your next 30 chest compressions, you would go back and give 2 breaths at that point.
And as a final note, if you're training to use the Dechoker, the back blows, or abdominal thrusts, realize that the choking Charlie is by far the best mannequin to use. Some of the other mannequins that are available out there for CPR certainly do not have the structure that choking Charlie has, and there can be leaks and there can be problems with the relief of any obstruction by any way.